She's a research associate at the National Bureau of Economic Research and an associate editor at the Review of Economics of the Household. She's an applied microeconomist with interests in labor economics, health economics, and economics of the family. She's done a lot of research on U.S. social safety net programs, particularly as they pertain to individuals with disabilities having access to services. Her work has been published in leading journals in the field, including the Journal of Public Economics, the Journal of Human Resources, Journal of Health Economics, American Journal of Health Economics, the AER, Papers and Proceedings, and the Ophthalmography Journal, Demography. So we're really excited to have her here to present new work on the spillover effects of the ACA's Medicaid expansion. Thanks so much for being here.
Thank you so much for having me. Can everyone hear me okay? Yes, okay. So today I'm going to be presenting joint work with two of my Williams College co-authors, Lara Shore-Shepard and Tara Watson. And we're going to be talking, as Joe said, about the spillover effects of the ACA Medicaid expansion on other safety net programs. This is part of a larger research agenda I have. One of the things that I'm really interested in is the way in which the U.S. social safety net functions as a patchwork of programs. And these programs have overlapping rules and overlapping groups of beneficiaries. And I think we in the States actually do not fully understand how they work. So I'm going to be showing you this paper today. We also have a couple of papers where we've created a safety net calculator that estimates eligibility and benefits for a number of different safety net programs, taking into account all the interactions between them. So we had a working paper that came out last week using this calculator to look at the effects of safety net generosity on maternal mental health. So I'm very interested sort of in these interactions sort of more generally. There we go. Up.
Let's try this again. Looks like it's connecting.
If I can. Okay, awesome, thank you. All right, so like I said, the safety net is this patchwork of public programs. The Affordable Care Act in 2010 significantly expanded one of those programs, Medicaid public health insurance. So given the way that these programs interact, we think that this change could have had spillover effects to other safety net programs. So the question that we're going to be looking at is, how did the Affordable Care Act Medicaid expansion affect participation in two major safety net programs, the Earned Income Tax Credit and the Supplemental Nutrition Assistance Program, or SNAP. So I'm going to be talking, I'll give more detail about both of those programs in a minute, although I think many people in the room are familiar with these programs. One thing I will point out is that both of these programs are large, serve a lot of people, and unlike traditional safety net programs, they're not as categorical as some of those other programs were. So for instance, the SSI program, which I've worked on, only helps either people who are elderly or people with disabilities. Tanf, which is the former AFDC program, helps single parent families. Both the EITC and SNAP are eligible to people across categories. The benefits for the EITC are larger if you have kids, but people without kids are still eligible. Okay. So if we want to think about how expanding Medicaid eligibility could affect participation in these other safety net programs, there's really like two main ways in which we think it might work. So one is changes in eligibility. So to the extent that the Affordable Care Act, by expanding Medicaid, affected labor supply, either by causing people to work more or causing people to work less, those changes in earnings could affect eligibility for these other programs. So you might imagine that individuals would reduce their income below the Medicaid limit to qualify, which could increase eligibility for these other programs. But there could also be people who were out of the labor market before who are now entering the labor market because they can have positive earnings and still get health insurance. And that again could change eligibility. But the literature to date really does not show very many employment or earnings effects of the Affordable Care Act's Medicaid expansion. So looking at this, it seems like maybe that's not going to be a huge pathway. We're going to find that it's not a huge pathway, just to preview the findings. It's also the case that expanding Medicaid could affect take-up of these other programs conditional on eligibility, right? So maybe it draws individuals' attention to other programs that they might be eligible for. Maybe it reduces transactions costs of getting on these programs. Maybe it reduces stigma. And I've become obsessed with this idea of administrative burden. So anyone who cares about the safety net should look at this book by Pam Hurd and Don Moynihan called Administrative Burden. It's really discussing like how the design of public programs makes it either easier for or harder for low-income people to access resources. So some states are trying to reduce administrative burden by linking data and application procedures across programs. You could think of this as an idea of maybe one-stop shopping, where you go apply for one program, and in a perfect world, they tell you all the other programs you're eligible for and take your information and transfer it to those other programs. That doesn't happen often, right? So that might be part of it. The other thing that we're looking at in this paper, and this is not in the version that I sent you, these are new results, is that some states have more unmet need. So for instance, if we're thinking about SNAP, there is a lot of variation in take-up across states in the United States among those who are eligible for SNAP. Some states do a really good job of getting people who are eligible onto SNAP. Some states do not. Okay, so we're gonna try to look to see whether some of these features, to the extent that we can measure them, are gonna affect these spillovers that we're gonna document. So what we're going to do, like hundreds and hundreds of other papers looking at the Affordable Care Act, yeah, Joe?
Sorry, so are there any other sort of health-related channels that we think, you know, if expanding access to insurance, I mean, I understand health could work through some of the labor market channels sort of that you were talking about, but what about sort of direct?
So we talk about this a little bit more so we have a companion paper that was funded from the same grant that was published in the American Journal of Health Econ last year, looking at the effects of the expansion on disability program applications and awards. So we talk a little bit more about it in terms of that paper. Like you might imagine that access to health insurance leads to improved diagnoses, and that makes it easier for people to get onto disability. We actually don't find any of that. We also think that if you have the health insurance, it could improve your health, right? And there's lots of evidence coming out of the ACA literature that shows that that's the case. But those effects, I think, are going to be longer term. I think we're unlikely to be able to pick them up in the short period that we're looking at. So. Okay, so we're going to use the Supreme Court decision that made the Medicaid expansion optional to the states. I'll talk more about that in a sec. But unlike sort of the standard difference in difference approach, we're going to use a county border pair research design, where we're going to examine participation of these other programs in contiguous county pairs that cross state borders. So imagine two counties that are right next to each other, but there's a state line dividing them, and one of those states took up the Medicaid expansion, and one of those states did not. So we're going to argue, I think there are people who will argue with us on this, that this allows us to better control for local economic trends or economic shocks that might affect social safety net participation. So then we're going to use individual level data from the ACS to explore mechanisms to look at joint program participation. We can directly see who's participating in which programs, to look at heterogeneity across groups, and to examine Tanf effects, which we can't do with the county level data. So with the ACS analysis, rather than the county border pair design, we're going to use a PUMA border pair design. And this is where I just want to take a sec to talk a little bit about the history of this project, because I think especially for grad students who are starting out, thinking a little bit about the glitches that you might run into when you have a research project could be interesting or informative. So we got a grant for this project from the Russell Sage Foundation. We were awarded the grant the week of the presidential election in 2016. We immediately applied for the ACS restricted data, which is where you get the county identifiers. So the application went in January of 2017. Multiple delays, multiple layers of approval. Someone went on maternity leave. We got approval to get into the census RDC in April of 2020, when we were all locked down. So we still, to date, have not been able to get into the RDC. So at this point, we're just kind of going with the Pumas. That's what we've got. We had held off on sort of finishing this paper because we were really hoping we were going to get into the census to get the county level data. I think at this point, my plan is that after I get everyone's wonderful feedback in this room, we're going to go home and finish writing it up and get it out the door. That's our plan anyway. So just to preview findings, the county level admin data suggest that the expansion significantly increases SNAP participation and does not seem to have significant or robust effects on EITC participation. And the results are actually quite similar in the ACS. So we see significant SNAP effects, positive and less significant effects on the EITC. Consistent with the previous literature, our ACS analysis really doesn't show much going on labor supply. I'll come back to a couple of nuanced findings in that towards the end that I think are kind of interesting, which suggest to us that the safety net program effects that we're finding are largely due to changes in take-up conditional on eligibility. So we've done a little bit of work to try to get at this, and we're finding that the administrative burden, at least as well as we can measure it, which is a huge caveat, doesn't seem to matter, but that we're finding larger effects in states that had lower SNAP take-up rates before. So these are kind of interesting new results that we have. Okay, any questions before I dive into the programs? No. Okay. So Medicaid is health insurance for low-income individuals in the US. It's expensive, but it also has been shown to have lots of positive effects on people's health and on mortality. One of the things that I think is interesting about Medicaid is that it's a federal-state partnership. So states operate within federal guidelines and get federal funds. And prior to the ACA, Medicaid coverage was really categorical. So there were different income limits for different categories in different states, but essentially you needed to be in one of these categories to be eligible. You needed to be a child, a parent, a person with a disability, or the elderly. So the ACA is kind of, in terms of thinking about the Medicaid expansion, is kind of revolutionary in that it says, we're not going to have this be categorical. Anyone who has income under 138% of the federal poverty line is going to be eligible for Medicaid. That was, of course, scuppered by the 2012 Supreme Court decision, which basically ruled the Medicaid expansion optional to the states. All but 12 states have eventually adopted, and many of them adopted it right in 2014. But if I show this graph, I showed this to the students in my upper level labor class last week. It looks really similar to any other map you will do of safety net generosity on any program in the United States. So I had showed them minimum wage, states that do and don't have higher than the federal minimum wage. It's a really similar pattern. If you look at welfare benefits by state, it's a similar pattern, right? So the states that took up the Medicaid expansion are clearly a non-random set of states, which is one of the things we need to be thinking about when we're evaluating impacts. So in terms of previous literature on these spillovers, there's not much that we're aware of. So the Oregon Medicaid experiment, that research actually looked directly at spillovers. So this was a Medicaid lottery in Oregon, and lottery winners had no positive effects in terms of their Tanf participation, but small positive effects on SNAP participation. There's this paper that came out this year in Food Policy that looks directly at the ACA Medicaid expansion on SNAP, so using a straight diff, and they find some positive and significant effects. Okay. The earned income tax credit.
I'm sorry.
Yeah.
In that paper, did they sort of discuss any of the mechanisms empirically that try to get at?
There's not much in there about the mechanisms. Yeah. So the Earned Income Tax Credit is the largest cash assistance program for the non-elderly. It works through the tax system in that people get a tax refund if they're eligible. There are separate schedules of benefits by filing status and the number of dependents, and take-up rates have been estimated to be about 75 to 79%. So if we think about how the Medicaid expansion would directly affect EITC, yeah, question?
So just getting back to the last slide, how does take-up vary by how close you are to the whatever threshold it is to qualify? So are people kind of just below the threshold not taking up because they have some expectation that they made on the future and there's some fixed cost to applying, or is it, people further away who are maybe low information?
Yeah, that's a really good question. I know that there's some bunching at some of the cutoffs and at some of the kink points, which suggests, actually, I think, for a while, the sort of conventional wisdom in this literature was that people didn't fully understand the schedules. It seems pretty clear, at least with self-employment income, that there's a lot of bunching. I haven't seen a similar analysis on take-up. So I think that would be really interesting to know, sort of like, of the eligibles, who is not taking up the program. I think it's hard to get at that unless you're Raj Chetty and have amazing tax data linked to everything else. But I think that would be a really, really interesting question to look at. So changes in labor supply on either the intensive or extensive margin could affect eligibility for the EITC, but this really depends on sort of a complex relationship between the EITC schedule and the Medicaid income limit. So for parents, you could see effects due to labor force entry, right? So before the Affordable Care Act, parents could get Medicaid, but the income limits were really, really low, so they might have stayed out of the labor force. Post-Affordable Care Act, they could enter the labor force, and any new earnings that were less than 138% of the poverty line would make them eligible. So it's also possible that there could be reductions in labor supply, but if you actually look at the schedule and where the Medicaid limits fall relative to the schedule for parents, it's kind of unlikely that that would happen. So for instance, like this line here is 138% of the federal poverty line for a family with one child. So someone to basically like gain eligibility, right, by reducing their income would be reducing their income by a lot. So we think it's unlikely we're going to see those decreases in labor supply for parents. For non-parents, I think it's a different story. So this is the EITC schedule for people with no children, and that is the federal poverty line, the 138% for a family of one adult. So it's easy to imagine, if you see those cutoffs, that you could have someone who would reduce their labor supply to become eligible for Medicaid, and then that could actually put them in the EITC phase-out range, right? So you might actually see some response there. So I think that's what that says. For non-parents, before the ACA, they weren't eligible for Medicaid, so we shouldn't see any effects on entry, but you could see effects in terms of them reducing labor supply. But then the other piece is more informational, right? The idea is that if you have low income, maybe you didn't file a tax return before, maybe you learn about the EITC now that you're on Medicaid, or you're nudged by the Medicaid system to file a tax return, and as a result, you increase your participation. Yeah, no.
So I want to get deeper into the sort of nudging and caseworkers of different, associated with different public assistance programs, and what they're encouraged or not encouraged to do, and whether that depends on the degree of federal and state matching, and what the objective function sort of the state welfare office is. What do you know? What do we know?
Oh gosh. So, I think we have lots of anecdotal evidence of this, and not, one of the things we've really been trying to do with this project is dig down and get information about kind of what's happening at the state level in terms of thinking about the interactions with these programs. And it's really difficult to do that. There's sort of no one source of that. It seems pretty clear, that if you think about some of the programs like Tanf, for instance, that in many states, the state and the caseworker objective function seems to be get people to not apply or get people off, right? I think for some of these other safety net programs, it's less clear, right? Sort of what's going on at the ground level. We're actually working on a project. I have a project now with Marianne Bittler and some other co-authors looking at California, which recently changed the policy to make SSI recipients eligible for food stamps. They weren't before. So I've had undergrads calling all of the CalFresh offices for each county to try to figure out like what's going on with outreach. And I think, in California, what we're finding is that all of that varies at the county level, right? So it's not even a state level thing. It's different counties are sort of doing more or less to reach out to this population of newly eligible. So that doesn't directly answer your question, but I think there's a lot more information that could be collected, but it's not as easily quantifiable, so I think economists haven't collected it.
Yeah, I mean, it's got to look very different from, as we were sort of chatting about earlier, what goes on with, with veterans benefits, for example, when you have a fair amount of information sort of being passed on about eligibility for the post 9/11 GI Bill or for certain disabilities benefits sort of going on. But I imagine it's looking very different.
Well, and I think the other piece of it, which we want to come back to in this paper in terms of discussion, is thinking about, again, this federal versus state component of it. So one of the papers that I did a long time ago was looking at the effect of welfare reform in the 90s on SSI caseloads. The idea being that single moms who were being moved off of welfare were moved onto SSI for a number of different reasons. And there were places and localities that had hired legal services to help those AFDC moms document their disabilities to get them onto SSI. So I think there's just like a lot of variation. And then when you have the difference in the financial incentives at the state level, like in a lot of cases, it's in the state's best interest to sort of move people onto federal programs or completely federal programs away from programs that are funded partially or totally by the state. So yeah, Shoshana.
Just a detail. You use the term food stamps. Do you mean SNAP?
I do mean SNAP. I'm sorry about that.
I
yes.
knew that, but
yes.
Maybe not everybody.
Thank you for clarifying that. Yes, absolutely. So I haven't gotten to my detailed description slide of SNAP yet, but SNAP is the formerly food stamp program. Absolutely. Thank you. All right. So SNAP, formerly known as food stamps. So SNAP is also a really big program, right? And it's a program that helped a lot of people during the pandemic-induced recession. So the household income eligibility limit is 130% of the federal poverty line, so very close to the Medicaid limit. Take-up rates, again, are roughly 75%, although as I mentioned before, there's a lot of variation across states. Some states have take-up rates estimated at 100%. Some have pretty low. California's was actually low, 60-something% from the numbers that I saw. The other piece of this that I think is really interesting is that, as I said before, everyone is eligible, but there are more restricted benefits for certain groups of people. And in particular, non-working, non-disabled adults. Some people will call these the young adults, as I'm on the other side of that cutoff. I actually don't like that descriptor here, but without children. So these are the ABODs, the able-bodied adults without dependents. They have limited benefits, except for when time limits are waived in their county. So with the Great Recession, there were a lot of these ABOD waivers to get rid of those time limits to sort of provide benefits to people for a longer period of time. Okay. Joe, what's the timing? How long do I have?
Till about 45.
Okay, perfect. So in terms of thinking about the mechanisms, if people are reducing their labor supply in response to the Medicaid expansions, that might also make them eligible for SNAP. You might expect that maybe there's a labor supply increase for those who were previously eligible at lower income limits, but given how close the SNAP cutoff is to the Medicaid cutoff, we don't think we're going to see any action there. And then there's this other piece about information or reductions in transaction costs. So data, we're going to use two main sources of data. We're going to use county level administrative data from 2010 to 2016 for a couple of different measures from a couple of different organizations. So census small area health insurance estimates are really just going to allow us to test to see whether our empirical approach gives us similar results to the previous literature looking at the effects of the Affordable Care Act on health insurance. The IRS statistics of income data give us the number of EITC returns for a tax year. The Food and Nutrition Service gives us the county level number of SNAP participants. One problem with these data is that SNAP cases are only reported at the state level for 16 states. So that's going to limit what we can do with the county level administrative SNAP analysis, particularly given our county border pairs approach. So we're going to be, I think, underpowered for some of that. We're going to look at census population estimates to come up with measures for controls of the age distribution of the population and race and ethnicity, and then use BLS data on the unemployment rate and the employment population ratio.
Sorry.
So the other thing we're going to do is, as I've already mentioned, use the American Survey, Community Survey data from 2011 to 2017, and that's going to give us detailed individual level data at the PUMA level, not the county level, on demographics, labor supply, and program participation. Okay. All right, so sources of variation in the Medicaid expansion. So a lot of the papers that have worked on the Medicaid expansion have used sort of a 0-1, expanded or not expanded. We test all of our results to see if they're robust to that specification, but we're really also going to try to get at the fact that some states had different income eligibility limits before the ACA was passed. So, imagine two states that go up to 138%, where one was at 0 and one was at 75, right? We might expect to see differential impacts. The target expansion date was January 2014, but some states expanded early, some later, and some never. I'm going to come back and talk about that a little bit at the end when I talk about two-way fixed effects and staggered implementation. So the typical approach to studying the Medicaid expansion is a state diff and diff, right? So you have treatment states that expand and control states that don't. You take your outcome measures and compare the changes over time in the expansion states to the changes in the non-expansion states. And the key assumption here is just parallel trends, right? The idea that if the treatment hadn't occurred, the differences between the two sets of states would have stayed constant over time. But again, I feel like I have to show this map and the fact that the states that took up the Medicaid expansion might be different than the states that didn't. So what we're going to do is use a county border pair approach. So this graph is from the American Journal of Health econ paper that I mentioned, where we look at the effect of the ACA on disability program applications and awards. But the idea here is that, the shaded areas illustrate county border pairs with dissimilar income eligibility limits in 2014. So in actuality, we're going to use a lot more variation than shows up in this map because other states expanded over our time period. It's also the case that California had some counties that expanded at different times. So some of our variation is actually coming from contiguous California counties where one of them took up and one didn't.
Excuse me, is California the only state that did adopt this change and were its county level?
That's the only one that we're aware of. I think all the other states sort of were all at once. Yeah.
So I understand the kind of the idea of using these county border pairs is to reduce the dimensions, of potential endogeneity. Urban areas are very different than rural areas, and for all kinds of reasons, and we would expect them to have parallel trends and so on. When you put that map up and you said, okay, like this, it looks like this for all of the other beneficiary plans, it makes me think that maybe that some of the things that we care about, particularly the political makeup of the state, and so on, that really does end at the state boundary. So I was wondering if you maybe just tell us a little bit about kind of what, how we should think about this state-county pair. What does this address? Are there lingering concerns in this context that we have in the back of our mind when we're seeing these results?
It's a really great question, I think, and one that comes logically from the way I've chosen to motivate this. So I think that as long as those differences are not changing over time, we're going to be okay with them in our empirical approach. So for instance, if one of those states always has a higher Medicaid, higher minimum wage and the other one doesn't, but if some of those policies are also changing over our time period in ways that are correlated, then that's going to cause some problems. And that's something we haven't actually thought as deeply about as I think we should. So it's a really great point. Actually, I should be taking some notes as I'm presenting this. So grab my paper.
I can follow up.
Yeah, of course.
No, I had also very related to, because you were talking before, Lucie, that in other ongoing work that you guys are calling counties, and that counties, there's huge variation across counties. So yeah, I was thinking of that. I was thinking, well, maybe if I have a county nearby, even if it's a different state, and I learned that this other county is doing X, Y, and Z to promote registration, I don't know, maybe I'm concerned about, a lot of households in my county that really need assistance, and I start taking up some of those practices.
Yeah, no, I think it's a really good point. Like, to the extent that information about the programs sort of might be spreading across these lines, then that's something we do need to think about. There's some pretty good evidence that suggests that people are not migrating across these lines in response to the ACA. You would probably know that literature better than I do, Catalina, but I think that it's something that we should probably think a little bit more about. Yeah, Joe?
What about so in the context of low-skilled labor markets with the minimum wage? You're aware of David Newmark's work on this. Why not empirically let the data sort of tell you
what are the better counties?
These are better counterfactuals.
Yeah.
Do the if you did, I think the way he did it in his ILR review paper was to do a synthetic control and allowing the based on pre-treatment trends in EITC receipt or SNAP in this case, to the donor pool to include counties that are nearby versus counties that are somewhere across the country, and see what the weights are on the synthetic controls. Is this the sort of best match, or even just descriptively to look at whether the observables look more similar with the contiguous counties across the border versus
so I'm going to show you a few things on that, but I think that using David's approach to try to use a synthetic control to sort of test that a little bit more explicitly than what we're doing probably makes sense. Yeah. So we've already talked about a lot of this, right? The whole idea behind the county border pairs is the idea that they share common labor markets and similar trends. So one thing I can show you is that before the Affordable Care Act, the mean absolute differences in outcomes and covariates are smaller for contiguous pairs. So if I look, here's from our EITC sample, so if I look at EITC returns, if I look at the unemployment rate, the percent in poverty, the percent non-Hispanic Black, the percent Hispanic, this is like all county pairs. They're sort of taking a county and sort of matching it with sort of the random pool of counties, and then this is the contiguous pairs. And you can see that the contiguous pairs have smaller differences in outcomes than sort of using all counties. So this doesn't get at Joe's point about like allowing the data to say, oh, well, this particular county would be a good match, right? Because this is not sort of looking to see which ones are particularly good matches. So I think it's still a valid point. But at least on this, it seems like the contiguous county pairs are closer than other things. So the key assumption here is that if the treatment hadn't occurred, that the outcomes within each pair of bordering counties would have changed in the same way. So just empirically, the first specification here is just kind of the straight diff and diff, but at the county level, right? So we have county fixed effects, we have year fixed effects, and we're going to use the non-categorical limit, which is the Medicaid income eligibility limit for someone who does not fall into one of those categories that I mentioned before as a share of the poverty guideline. Our county border pairs effect specification is really similar, right? We have county fixed effects, but now instead of a time fixed effect, we have a county pair by year fixed effect. And by including that, that's going to limit our identifying variation to just differences between those contiguous counties. So just in terms, this might be way more in the weeds than people want to get, but basically the way the data look when we do this is we have, for each observation is a county a county pair and a year. So if county A bordered counties B and C, then that's going to show up in there 4 times. So county A as part of pair AB, county B as part of pair AB, county A as part of pair AC, county C as part of pair AC. And then we take into account the fact that we have multiple observations for these counties and both reweight and adjust the standard errors to account for that. Okay, so before I get into our actual results, we wanted to do kind of a descriptive exercise using the data to sort of show what we think the value of this approach is. So we're going to break counties into 2 groups, those that ever expanded Medicaid and those that did not. And then we're going to regress some outcomes on the interaction of the ever expanded dummy with dummies for each year. So then we're going to show the standard diff and diff for all counties. Since our preferred specification is only on the sample of border counties, we're going to show an intermediate specification that uses the contiguous county sample, but the straight diff and diff. And then finally, our preferred specification, which is controlling for the border pair year effects. So this just shows the Medicaid income limit, right? This is the policy variation that we're using, and you can see here that you get pretty similar results for all 3 specifications, right? So here's before the policy change, and here's after the policy change. If we look at the percent uninsured, it actually looks like our border pair effects specification gives us bigger impacts in terms of the percent uninsured, which would be consistent with the idea that the states that expanded were sort of different in some way than the states that didn't. Is a question?
Right. Yeah. The interpretation is, I just had a flashback to the rest specification class. These aren't, what you're presenting here, these aren't the 0-1 like policy indicators. This is like a dose response type.
This is, oh gosh. I think this is actually, this one is, so my main results that I'm going to show you in a few slides are the continuous. I think this is actually the 0-1.
Oh, okay.
Yeah. Yeah. I think that's right. All right, so if we do the same thing, this is the county level EITC data. You see kind of a similar pattern here in that the diff and diff is actually going to give us bigger effects than the border pair approach. That's going to show through in our main results as well. The SNAP, this is the county level SNAP data. The results look very similar. This weird 2016 effect, I think, is due to the fact that we're losing some states in 2016 that are no longer reporting SNAP data at the county level. But when we do the same thing using the ACS data, you see results for SNAP that are actually relatively consistent across the specifications. And I think in general, like these simple descriptive diagrams preview our pattern of results really clearly. So what I will say is that in the paper we published last year with disability applications and awards, the county pair approach makes a difference. So the straight diff and diff shows a significant increase in disability applications. The county border pairs do not. We get a pretty precisely estimated 0 in that paper. In this paper, it seems like for the EITC it matters, and for SNAP our results are relatively consistent between the straight diff and diff and the county border pairs approach. Okay, questions?
And what's your, I mean, this is heading too much sort of toward,
are you going to ask me a philosophical question?
Which is this, yeah, sort of the story, like given the different results sort of across the 2 papers, across these different types of programs, what kind of stories are kind of, most consistent with why you would?
We have really grappled with this one because I think it's a logical question to answer given sort of what we're finding in the previous paper and what we're finding here. And what we would like to be able to say, the question has been posed to us, what advice would you give researchers who are working in this area? And like one thing I can say is, oh, well, you could try both ways and see if it matters. That's not at all helpful because lots of times people don't have the data that they would need to do the county border pairs approach. So I don't really have a great answer for that one, to be completely honest, but it's something you're right we should think a little bit more about. Okay, so with results, what I want to do first is just show you that the results on health insurance are really similar to what you get from the previous literature. So we know that the Medicaid expansion is associated with a significant increase in health insurance coverage. And we see a really similar pattern. This echoes the descriptive pictures I showed you before, where with the diff and diff, you get a negative and very significant effect on the percent low income uninsured. And with the contiguous counties, you get an effect that's much bigger, like almost twice the size. So just in terms of interpreting that, if you moved the income limit from 0%, so no expansion, to 138, full expansion, you'd see a reduction in the rate of uninsurance of about 3.8 percentage points. So that's about a 12% decrease relative to the mean. And I think that's largely consistent with the magnitudes you get out of the previous literature of the effects of the Medicaid expansion on health insurance. So if we look at EITC returns, what we find is that the diff and diff suggest a positive and significant effect. The contiguous counties, our preferred specification, also shows a positive effect, but about half the magnitude and no longer statistically significant. And in terms of thinking about whether it's economically meaningful, it's really not, right? So moving an income limit from 0 to 138% would increase the EITC by 0.12 per 100 working adults. So it's both sort of not statistically significant and also quite small. Yeah?
Just curious about the choice to focus on the non-parent income limit. I'm not an expert in SNAP or UHC, but it sounded like maybe parents would be more likely to be eligible for those programs than childless adults. And so some of these states that didn't cover childless adults at all pre-ACA would have been covering parents.
Yes.
I'm just wondering if you...
Yeah, no, and that's a really great point. And we've kind of gone back and forth on this, especially in the previous paper, because there were also disability limits, right? So like what was the relevant limit? And basically what we thought was that if we wanted to figure out, you know, the possible effects on the largest group of people, that was going to be the non-parent, like the non-categorical limit, which in most states was, you know, pretty low. I'll show you the ACS results where we're breaking it out by category. And in that, we're looking separately at parents and non-parents, and we've done some specifications where we're using the parent limit there, and the results are actually pretty similar to what we get here. So it's a great question. Okay. All right, so if we look at the county level analysis again, the effect on SNAP, what we're finding is a positive effect. It's more significant with the contiguous counties. And this is about, so if we go from 0 to 138%, we're increasing SNAP by about 0.55 per 100 people in the population, or about a 4% increase in SNAP participation. So I think that the conclusions from the County Board of Care analysis, we're not finding much going on with the EITC, but the SNAP effects are significant. And just in terms of thinking about what those magnitudes mean, the coefficient that we get on SNAP compared with the coefficient in terms of insurance would basically imply that about 30% of those who were induced to get insurance from the Medicaid expansion also were induced to participate in SNAP. And that's big, right? So if you compare that with the results from the Oregon experiment, they have a 2.5 percentage point ITT effect for the lottery winners. That would imply about 10% of those people who went on Medicaid were induced to participate in SNAP. So like one thing that I think is worth having us think a little bit more about is what Oregon looked like in terms of some of these administrative burden and scope questions that we've been interested in, to see if that might explain some of the difference in terms of our findings relative to those findings. So we have these county level administrative data effects. On the one hand, county level administrative data is great because it's actual numbers of recipients, so it's not subject to underreporting. You know, Bruce Meyer's done a lot of work on underreporting and survey data. On the other hand, it reflects this net effect of these competing mechanisms that I was talking about earlier, right? So we want to try to dig into that a little bit more. So we're going to move to the ACS. This is my long sob story about the RDC, and implement this PUMA border pair design. So our ACS analysis, we're going to look at those ages 25 to 64. We're going to do everything on the full sample of people those ages, but then we're going to break them out into demographic groups in a way that's not common in the literature, and it really has to do with the different program rules. So the first thing we're going to do is look at married versus unmarried parents, which is due to the differing EITC rules by filing status. Then for non-parents, we're going to look at the young non-parents, right, those under the age of 50, and then non-parents who are old, 50 and over, and that's due to the differing SNAP eligibility requirements by age, that age 50 cutoff. So we're going to add controls for demographic group when we have the full sample in, for race and ethnicity, gender, education, age, and age squared. And we're going to look at health insurance. We're going to look at reported participation in SNAP. We're going to look at EITC eligibility. So one downside of the ACS is it does not report EITC participation. None of the survey data sets, the big ones, really do that. So we're going to look to see whether people are eligible for the EITC based on their income. But really, it's just another way of measuring labor supply. So I don't want to push that too much. And then we're going to look at labor supply measures. Yeah.
Wondering for California, how are you putting that with your change in eligibility since some of the counties have extended to some extent before?
That is a really great question that I actually don't know the answer to off the top of my head, but I should check on that. Yeah, we should definitely check that. All right, so the individual level analysis, so basically all the results I'm going to present show the full sample in the first column, the young non-parents, the old non-parents, the single parents, and the married parents. So what we see here with the health insurance is that the effects are across the board, right? All of these groups see increases in their health insurance coverage as a result of the Affordable Care Act's Medicaid expansion. The effects are larger for people who are under 130% of the poverty line, which is what you would expect. And actually, there's a really big increase for non-parents under age 50 who wouldn't really have been eligible through other sources here for that particular group.
Do we have any sense, I know Jeff Clemens has written a bit on whether this is causing sort of, is there any sort of substitution away, so on net, health insurance is sort of going up and driven by Medicaid. Is there any sort of subset of the population for whom you're seeing a decline in private insurance? I mean, I know you just care about sort of the net effects on insurance, but I'm just sort of thinking through some of the downflow sort of effects on the outcomes you're most interested in.
Yeah, I don't know if we've actually run that, but that would be pretty, we obviously have that variable in the data. It'd be pretty easy to actually run that. Yeah, Brandy?
I actually was going to make a similar point, and I know kind of in the Medicaid literature, there's definitely evidence of brownout, quite large actually. I think in some estimates, it's like the Medicaid estimate would be double the change in any insurance, which would also change kind of your 30% coverage.
Yep, no, that's a great point. That's a great point. Okay. All right. So here what we're doing is we're looking at our safety net outcomes. So I'm actually going to start at the bottom of this. So any Tanf, which is a measure we could not look at with county level data because there's no county level Tanf caseloads, what we're seeing is a positive and significant effect of the Medicaid expansion on Tanf. And that is coming from, parents, which is what you would expect given Tanf rules. What I will say is, and I'll talk more about this towards the end when I talk about robustness, we've done adjustments to everything for multiple hypothesis testing. So these are the unadjusted standard errors. When we adjust for multiple hypothesis testing, the Tanf results aren't very robust to that. They kind of go away. The SNAP results, on the other hand, are pretty
Can we focus more on the...
Yeah, of course.
I mean, there's an amazing difference between single parents and married parents. And can you explain it?
Yeah, so the Tanf rules would basically basically lead to that. So you're eligible for TANF if you are a single parent or if you are a married couple with an unemployed parent. So most of the people, at least historically, most of the families that were on TANF were single parent families. So that would explain, they'd be more likely to be eligible. Yeah, sorry, I didn't mean to gloss over that quickly. What we're finding here, again, so if we look at SNAP, we're finding effects across the board for all of these groups. We're finding that those effects are larger, right, if you are under 130% of the poverty line. And then when we look at SNAP in conjunction with public health insurance, we're finding some interesting patterns of results. So the likelihood that you report both SNAP and public health insurance goes up for all groups. The likelihood that you report SNAP and no public health insurance goes down, so there's fewer people who are just reporting SNAP.
And sorry, that means either uninsured or private?
So it would include both.
Okay.
Yeah, and I don't know if we've actually broken that out. That would be worth doing given the earlier point. That's a great point. But then we're also seeing that there's an increase in the likelihood of those who are reporting public health but no SNAP. So again, I think the way to think of this is some people are being induced to apply for Medicaid, to get on Medicaid. Some of those people are also induced to go on SNAP, but not all of them, right? So I think that's kind of what we're finding here. So we've also done effects on the earned income tax credit and labor supply. And what I will say is that we're finding small positive EITC effects, some small effects on labor supply. Very few of these effects actually hold up to multiple hypothesis testing. So we don't want to put any real weight on them. But what I will say is that there's two patterns that I think are worth further investigation, and I need to look into the literature that's come out since we started this paper. But it does seem like there's a little bit of an intensive margin increase among the young non-parents and a little bit of an extensive margin increase among single parents. And I haven't seen papers that have looked at the labor supply effects of the Medicaid expansion sort of broken out by those groups. So I think that sort of looking into that a little bit more to see whether anyone has looked at that, whether it's a finding that that exists in the literature or whether that's something that's new would be interesting. Okay. So this is the part that's new. This isn't in the stuff that I sent you, but this question about whether local characteristics affect spillovers between the Affordable Care Act and SNAP. So for this, we're actually going to move back to the state diff and diff. And as we're rewriting this version of the paper to get ready to submit it, I think we really need to reconcile in our heads when we go back to the state diff and diff, given that I've just told you that the state diff and diff is bad. I think we're treading a little bit of rough water there in terms of motivation. But what happens, one downside of the county board of pairs approach is that because you're identifying off of those differences that are on the map that I showed you, if you further cut the data by state characteristics, you know, like a state with high unmet need versus a state with low unmet need, we're just basically losing some of our variation. So it just gets harder and harder to do these things with the county board or pair approach. So we're going to interact our continuous Medicaid income limit with state characteristics. So the first thing we're going to look at is, did the state have a SNAP ABOD waiver, one of those waivers that got rid of the time limits that applied to the young non-parents? We're going to use an index of SNAP availability. This is from the Ganong and Liebman 2018 AEJ paper. It's 8 different policy variables that show how easy it is to get on and to stay on SNAP. We're also, because what we're really interested in here is entry onto SNAP and not necessarily continuation onto SNAP, we're also going to include a revised version of Ganong and Liebman that really looks at just the features of that apply to getting on SNAP for the first time, which is going to include the call centers, the online applications, and then broad-based categorical eligibility. And then finally, this question of scope or unmet need. So we've got the fraction in the state of SNAP eligible people that do not participate in SNAP.
Sorry, are these time varying measures or these
No, so we're
pre-treatment?
using them pre-treatment, so 2010 values. Yeah. Okay, yeah.
Is there any evidence or anything that you've read about states, particularly expanded Medicaid, trying to kind of couple that with meeting the SNAP?
So we've found very, very little on this. We've been trying to find things to the extent that we can. I think one of the things that we're running into if you go back to the map that I showed you of the expansion states, some of the states that, like, we've tried to collect other measures of this administrative burden, like links between Medicaid data and SNAP data and things like that. And one of the problems that we're running into is that the states that expanded Medicaid are also the states that we're trying to reduce the administrative burden for the recipients, right? So we're finding that, these things are correlated in really important ways, and it's hard to disentangle the differences. We were all excited about the it's gotta be administrative burden if we could come up with a good measure, and it's possible that there's a measure out there that's a good one, but I just have not been able to get my hands on it, despite lots and lots of work. So, all right, so what do we find here? So this basically shows, again, like using the, is this the ACS data? I think this is the ACS data. Now I can't actually remember, but we're basically doing sort of, okay, so straight diff and diff, the effect of the non-categorical income limit. If we interact that with the ABOD waiver, we're not really seeing much going on there. If we interact it with the overall Ganong and Liebman, it's positive but not statistically significant. If we interact it with the application index, so the features of the Ganong and Liebman that were specific to applying, you see sort of a marginally significant effect. But the big, I think, effect here is the unmet need. And this should make sense, right? If you have a state that has lots of eligible people who were not on SNAP before, then having them have access to Medicaid is going to pull more of them onto SNAP. And actually that basically explains all of our main finding is coming from those states that had higher unmet need. So I think this is an interesting finding. It's hard to think a little bit about, well, what does it mean for them to have unmet need and what were they doing differently than the other states? And I think this is where, again, like trying to match up some of the stuff I was collecting on administrative burden with those measures of unmet need to try to explain it would be really helpful. It's something that I haven't done yet. Yeah.
So I'm curious, so I really like this use of these different indices and the unmet need as a proxy for this administrative burden. I think that's really neat. I was trying to think about a way to do it, and this is way better than anything I came up with in my head. But this unmet need thing, it seems like there could potentially be a mechanical relationship there, whereby once your unmet need is very small, there's just no policy that's going to then push people any further, right? You basically maxed out the people that could be on SNAP.
Yeah, yep.
So, one way to think about that would be to, and I don't know how you are empowered, but rather than just do that one category, do some non-parametric bins or something to see if it looks like it's driven by a mechanical scale there, or if it looks like it's a consistent kind of monotonic.
Yeah, no, that's a really, really great point, because we do have states that are at 100% for take-up, so I think that's something that we should really look into. We've gone back and forth, my co-authors and I, about this question, like which states would we expect to see the biggest effect? Like on the one hand, there are these states that have high unmet need. Like on the other hand, like why all of a sudden would a state that had high unmet need, they were doing a terrible job getting people on SNAP. So why would getting people on Medicaid like instantly make it easier for them to get on SNAP? And I think part of what we really need to do here is be talking to some people. This goes back to Joe's earlier question in some of the local offices to try to figure out like how does this work? Like what's happening in terms of the process? Someone is applying for one program, are you actually getting them moving on to the other program? Yeah, Shoshana.
Do you think it's optimal to have effects on labor supply and effects on use of these other programs in the same paper? Because, just 1 or 2 slides ago, your dependent variable was labor supply.
Yeah.
And it seems to me that perhaps from the point of view of optimizing the marketing of your ideas and findings, it might be better to just have a separate paper just on the labor supply.
Yeah, I mean, I think our thought here was that we weren't interested in labor supply so much as an outcome on its own. We were thinking more of it as a mechanism by which it might affect eligibility.
Of both EITC
of both of these programs, yeah. And given that the previous literature finds very small or no labor supply effects, like there's lots of papers that have looked at labor supply.
It seems like if that's the case, that the previous literature did not find labor supply effects, that seems, I'm not an expert on this literature, but it would seem like that's a big deal, that you find this labor supply effect, which has not only implications for this, but has policy implications.
Yeah. I think that's right. The fact that we're finding some small labor supply effects for particular groups that haven't been examined could be something that would be worth looking into. No, I think that's a good point.
See,
yeah.
I'm not very, I mean, I don't know much about these programs in general, I mean, the specifics, but how does the registration differ for the different programs?
How does the
registration or the participation, I mean, if you are interested in participating in this program, do you go to the same agency, or do the agencies have offices?
So in most cases there are different offices for all of these things. Like, so for instance, like I was talking about the California example before, for SNAP there are CalFresh offices for each county. And it's administered at the county level, and those you cannot apply for other programs there. One of the things that's kind of interesting that we're finding in our qualitative interviews of the CalFresh offices for this other project is that some counties seem to have very close relationships with the Social Security disability offices, the ones that are doing the disability determinations, and some don't. So in terms of thinking about the link between SNAP and SSI at the county level, like there are some, and then there are also counties where there's a third, like a nonprofit or a charity of some sort that's working closely with both. So I think there's a lot of variation here in terms of how it's working. And again, like I think this is one of these areas where we don't have good data, but if I could get a grant funder to fund, like a serious data collection project that would try to figure out like what is going on at all of these local levels with all of these different safety net programs, like that would make me so happy to be able to kind of collect that information.
Yeah, and then I was thinking also related to this SSI, that we have worked on this before, but so, there was all this literature saying how immigrants are particularly, the ones going in participating in large numbers in SSI, and how they prolong the participation, and all this concern of getting away from that, and whether networks play a role in passing on information about the program and so on. And I was thinking if you have seen something similar with these other programs.
With immigrants in particular. Yeah, so we, for this paper and also for the paper with the safety net calculator where we're looking at the interactions, we've kind of at this point explicitly excluded immigrants from those analyses, in part because the program rules they're much harsher on immigrants and much more complicated. So, but I think that that's a hole in this literature, right? Is not fully understanding how these different programs apply to the immigrant population. And obviously that's going to be really important in states like California, Texas, and New York, for sure. It's a great question. All right, so summarizing the ACS results, the Medicaid expansions did have this positive effect on SNAP. With the ACS results, we find that about a quarter of the new non-parent Medicaid recipients were induced to get SNAP. It doesn't seem to be driven by labor supply, so it suggests a role for information or transaction costs, and those effects are larger in places with unmet SNAP need. So positive effects on EITC eligibility, but I'm not going to hang my hat on them. So robustness tests, we've done binary expansion variable, we've added some controls, we've done the multiple hypothesis testing, and of course when you sit on a paper for 4 years, then you have to deal with like methodological advances in the literature. And you sort of curse your co-author for identifying these things. So I'm sure everyone in this room knows this at this point, right? The two-way fixed effects estimate provides us with a variance weighted average of all of the 2x2s. So one issue, not the only issue, is the use of the previously treated units as controls for newly treated. The bias can be most serious if all the units are eventually treated. That's not true in our case. I think the bias can be worse if you have a long sample. That's not true in our case. So what we're envisioning here is kind of an appendix or a robustness table that will sort of address this. We've done the Bacon decomposition with a binary expansion variable, and it gives us, this is the diff and diff. Is this working? The diff and diff estimate of the effect of the expansion on SNAP participation. Over 90% of the weight is on the good comparison. So either treated versus never treated, or early treated versus later treated before the late group turns on. If we take out the bad comparisons, it gives us very similar results. The other thing we've done are some robustness tests using state diff and diff. So we've compared only the states that turned on in 2014 with the states that never expanded. And the SNAP results are positive, they're smaller in magnitude, but the main story holds. We've also done this thing, and I'm not sure how I feel about this. This was like my co-author running regressions on Monday, like before I was getting ready to go onto the plane. So we compare states that expanded in each year with those that never expanded. So the states that expanded in 2011 with the never expanded, the 2012 with the never expanded, and so on and so on. And we basically could, I think, create like a figure that shows the coefficients and the standard errors. The SNAP results are positive in all the years, but vary in statistical significance. If we think about this, though, because we're going back to the state diff and diff, this is this tightrope that I have to walk on here. Like the states that expanded in 2011 compared with states that never, so these are states that chose to expand early, so they care about getting people onto health insurance, with the states that never expanded. So to me, like, again, that sort of gets us back to all of the questions we had about the diff and diff in the first place, but worse. So again, like, I'm really not sure how I feel about this, but I think it's encouraging that the results are sort of robust to that kind of analysis. Okay, so I am almost out of time. Conclusion, look at the time. Did you see this? All right. I pat myself on the back. All right. So just to wrap up, I think that our results imply that there are important spillovers across safety net programs. We see that about a quarter of those who got public insurance due to the expansion were induced to participate in SNAP. And I think one of the questions here that's really interesting and important has to do with the costs, right? So the federal government has costs that are of expanding the ACA, and they're making transfers to these expansion states. But because SNAP is a federal program, those transfers that the federal government is making to the states are bigger than just the Medicaid numbers would imply. On the other hand, like, these additional inflows of SNAP dollars to states are an added benefit of the expansion. And I think one of the things that's kind of interesting about SNAP in general is how it relates to other programs. So southern states that tend to have really low cash benefits in other programs, end up with higher SNAP transfers because TANF dollars or SSI dollars count against, they count as income for the SNAP program. So we're already in a system where sort of the more generous states are subsidizing the less generous states in terms of SNAP dollars. There are these extra dollars sort of to be had by some of these states in terms of the Medicaid expansion. So I think this question about safety net take-up and why isn't take-up 100%, and what are we doing with our policy design to make it difficult for low-income people to access programs for which they're eligible, is a really important and unanswered question. Quarter of.
Thank you so much. Any final questions?
I have a question too, and it's just more general, but what do we know about the efficiency of giving people money versus food. So if I were to invest more dollars from the federal government
Yeah.
in a particular program, should I go and put more in the SNAP
Yeah.
bucket or in the...
So this is a great question, and it's related to the project I was talking about with California. So one of the things that we've done in that project is look at historical data. So if you look at when SSI is implemented in the 1970s, 5 states, including California, chose to not have their recipients be automatically eligible for food stamps, but to cash out their benefit instead. So they got basically the cash equivalent of the food stamp. So we've used some historical data from the 1970s, a sort of a survey that was done of people on the programs that were replaced by SSI, and then after SSI was implemented. And we're finding that in the states that did that, California and the 4 other states, their income stayed the same, but there was a shift between cash and food stamps, so they had less in food. And we're actually finding increases in food insecurity. So they're more likely to say that they didn't have enough food and less likely to say that they ate the right kinds of food. So that would suggest that it matters, right? Other people in this literature, Diane Schanzenbach in particular, have said in their work that it doesn't really matter, that people are spending cash and food the same way. So I think there's a question there. We're in the process of getting data, California administrative data, to look at the 2019 change. And we're going to be linking that to some health data. So I'm really interested to see if that...
If they have kids.
Exactly.
That's basically where you want to see the nutritional...
Absolutely. So I'm really excited to sort of look at that and see that. Yeah, Audrey.
This is tricky too, right? Because there's a literature that suggests that if you give the money to mothers, right? So if you're giving the money to the household head,
Yeah.
then it may not be spent in the same way. So you really want to know what happens if you give the money to mothers versus food to mothers, and which is better rather than just money to the family.
But that's really interesting. So I think that one thing I could do with my SSI project, especially with the historical data, is look separately, because the people with the disabilities that were moving on to SSI, and SSI benefits go directly to an individual, right, not to the household. So I could actually break that out by gender to see if there were differential effects. So that's a really good idea.
Very good. Thank you so much. I want to especially thank Lucie. She was the 100th CHEP seminar. Congratulations. Balloon she brought.